Prevention of Gum Disease, a digital education program. An oral hygiene demonstration on a 3D printed tooth model. Practical demonstration on a 3D printed tooth model. Topic A, toothbrushing. Topic B, brush in between teeth. Topic C, brush on the gum line. Most people are not cleaning their teeth properly because they have not been shown. It is not your fault. Don't feel bad if you don't master these techniques immediately. It takes time. Keep going, and you shall get there. Prevention advice varies, depending on the state of your gum health. People with healthy gums need different advice to someone with severe gum disease. So, this is general advice only. You really need to see a dentist for detailed guidance with your mouth. For people with dental implants, they need expert advice. Cleaning teeth properly takes a long time at the start. We use the 3D printed teeth model to train our cleaning techniques. This should help us to clean our teeth effectively, and later clean more quickly. To remove plaque completely, you need many different instruments, not just a toothbrush. Start by learning to brush effectively, and then move on to the other items.
Using a toothbrush. First thing we need to do is look at the brush head itself, and we're looking to use a small head and one with soft bristles that get into the sides of the teeth and are gentle on the enamel. Why is that the case? Well, I've just put some green Play-Doh to mimic food and plaque and debris. Now, if we have a large brush, then when we're brushing, we're going to miss this debris because the brush is so large, it can't maneuver as well in that area. Whereas if you have a small brush, then it's much more nimble at removing and moving around the tooth itself one by one. The second thing is, when you're using a brush, and you need to make sure you're going around the curves of the teeth. So if you have a look over here, the teeth have their own curve which goes from here to there, and then there's another curve with the teeth going across. So you're not just going across like this. What you're doing is you're following the curve of the tooth from the back of the tooth to the front of the tooth. And then there's another curve, which is the curve from the top of the tooth to the bottom. And what people do when they're brushing and they're just going side to side is, and especially if they're going side to side on the top, is they're missing the base because they're not following the curve of the tooth from the top to the bottom. So if we use the electric toothbrush. And the other thing to bear in mind when you're brushing, when you've got teeth which are crowded, which means they overlap, like this one over here, then again, if you're brushing across, you're going to miss this tooth. And when you're brushing, you want to make sure that you follow the curvature. But in this case, with this teeth overlapping, when you're brushing, you'll need to make sure you have another angle for this tooth. There's one angle for the crowded tooth, and then there's another angle for the tooth next door. So that's another thing you need to be aware of, is when you're using an electric toothbrush, it needs to be a continuous motion, and it does the work for you. So you just need to let it do the work. So rather than using the brush and scrubbing with your hand, all you're going to do is just hold it and just let it do its work. So again, you're following the curve of the tooth from back to front, and you're also following the curve of the tooth up and down. And down. Now with this crowded tooth over there, you need to use a different angle. And you're following the curve from side to side and from top to bottom, just so it reaches the gum line there. Now, the next thing we're going to do is clean in between your teeth. This is for areas where the toothbrush simply can't go in, because this is the area where the food and the plaque is jammed between your teeth. So the inter-proximal brushes are these, and they come in different sizes. Now, the way you use them is wherever the gaps are big enough. You don't force the brush in between the teeth, but you use a smaller size if it doesn't work. So let's try from the outside. This is going in, and you can also use it from the other side in your mouth. Now over here, this is too tight a gap, and if it's too tight and none of them fit, then that's where you need to use floss instead. So let's try the red one, and that goes in. That's actually better. That in. We'll try the other one, and this gap's a lot bigger, so we could use the blue one. Right. How to floss. So when people floss, the idea is you're putting the floss between the teeth, and what some people do is they saw the gum side to side, and you don't want that. What you want to do is put it in between the tooth, wrap it around one tooth, and then you just lift up. Then what you do is you put it down, wrap it around the other tooth, and lift up. Another issue which people have is when they're flossing, they don't go all the way down to the margin of the tooth here. So you can see where the green bits of food and debris are. So when they floss, they just go like this, and they lift up, but they're not going right to the margin, and that's what you want. So put it in, wrap it around the tooth, and you go all the way to the bottom, and then you lift up, go in again, all the way to the bottom, and you lift up. Then you go in again, you wrap it around the other side of the tooth, and you lift up. And now you should have got most of that debris up. Go back in again, wrap it around the other side, and lift up. And that's what we're doing. Right. So how to brush at the gum line. So you've used the electric toothbrush, you've used the inter-proximal brushes to clean in between your teeth, and now what you use this single tufted brush, and what this does is it cleans around the gum margins and any plaque or debris. And you're not going to use it in a forceful manner because the gum line here is very thin and very fragile, so you're going to clean more against the tooth rather than pushing down on the gum harshly, and you're just trying to remove any of the plaque that's around the gum line, like so. And you're working on the outside, and you're working on the inside. There we are.